My name is Lin Wenhua. Today, I would like to introduce nursing strategies and intervention for suicide prevention in both of hospital and community, especially for adolescents. And this is my background. I'm currently working as a registered nurse in acute psychiatry ward. I'm also a master student of nursing at the same time. Here's the outline today, which is basically talk about hospital and community-based nursing care. So, in terms of hospital-based nursing care, when a patient admitted, the very first thing we have to do is assessment. Here is a common assessment method, which is called mental status examination. It can help us to quickly screen and understand the patient's condition through ABCD. A stands for appearance, affects, and attitude. B stands for behavior. It includes the ways that patient talks and behaves. The assessment points in this part is quantity and quality. C stands for cognition. The contents and process of cognition have to be assessed. D stands for drive, which means that basic human needs. So this slide is an example that shows how assessments for a depressed patient will be like. Also, because of depression will change patients' usual patterns and responses, it's helpful for better understanding of patient if we compare the baseline and recent condition. And in order to apply a comprehensive assessment, interviews, observation, and standardized assessment tools have to be used. When a depressed patient admitted in the hospital, we have to keep in mind that suicide thoughts or plans should be always assessed. And this suicide history should be asked directly so that we can further provide more individualized suicide prevention for each patient, such as we can ask patients that some people will hurt themselves when they are extremely frustrated or depressed, and you? Or have you been thinking about killing yourself recently? And then keep focusing on identifying the suicide intensity, methods, and related factors, such as any major life events recently. When we do an assessment interview, observation for patients' verbal and nonverbal responses are also important. Particularly, we have to be sensitive in nonverbal responses, such as eye contact, facial expression, gestures, and body posture. It gives us thousands of messages. However, if the therapeutic relationship haven't been developed when patient just admitted, they probably won't tell you too much. So, at this moment, standardized assessment tools are useful to identify specific information for us, such as risk, severity, and rescue label. So, this is the example of conducting and recording for suicide assessment. And this example of safety plan. Okay, so after the assessment, we are moving on to nurse intervention. And basically, there are 5 domains we can support our patients. The first one, patient safety, which is the highest priority when we provide the care for depressed patients with suicide thoughts or plans. In regards to patient safety, we need to maintain a safe and protected environment setting. It's about the removal of dangerous objects like belts, necklace, shoelace, sharp implements, glass, and etc. at admission, and keep monitoring regularly. Arrange the bed close to nursing station or even in a segregated protection room or ICU for those at high risk of suicide. We need to closely observe and monitor where patients are. For example, if patients stay too much time in the bathroom, you better to go and see them if they are alright or not, and how's their mood and what they are doing now. And then tell your patients verbally and also non-verbally that the team will protect them and keep them safe. And make a suicide contract with patient might be also helpful. Another important thing is about communication board that telling all health professionals being aware of high-risk suicide patient is necessary. The second nursing intervention is physiological care in the aspects of intake, excretion, activities, sleep, and personal hygiene. So, why intake is so important? Because depressive patients might have no appetite, or they want to punish themselves by eating nothing, or even swallowing the plastic spoon. That's why it needs to take time to stay, monitor, and record their intake. We can also encourage adolescents' parents to bring other snacks with high calories and protein, which is easily digested and based on patients' preference, of course. And in terms of excretion, because of depressed mood, decreased physical activity level, or side effects of medication, patient might have constipation problem. It's necessary to encourage to drink water and be active during the day. At the same time, depressed patient might also lie in bed all the day or have a difficulty in sleeping. So, encouraging them to develop a structured daily life schedule and reduce caffeine can improve the problem. Also, many depressed patients feel themselves worthless and don't even care about their personal hygiene. So, we can encourage them to bath and grooming by themselves or guide them with clear explanation. When personal hygiene is completed by patients themselves, it's important to praise them cleanliness, since all the process of physical care is also the ways that improve patients' independence. It's also the ways improve patients' independence. Okay, so when talking about psychological care, therapeutic relationship is the most fundamental and important domain. It's gradually developed when we provide physical care for patients, because what we do at the same time is sharing time in a supportive manner for patients. And of course, warm, genuine, and accepting approach is important. And it's needed to communicate in calm voice, warm tone, being supportive and encouraging, even if patient doesn't talk much. Here are some tips of how to interact with adolescents. Adolescents particularly concerned of confidentiality. So, except of suicide information, a discussion should always be had with adolescents about what information they are happy to share with their parents, and make sure of discussing reasons for not sharing information. Sometimes control means abuse for adolescents, so it's better to collaborate with them rather than control them. Show a respect to adolescents' independence and mature aspects. And fourthly, we have to set limits and provide structure can encourage adolescents' independent functioning. Also, many young people with low self-esteem might wondering if they are worth helping and become sensitive and will pick up any inconsistency between what we say verbally and non-verbally. So, providing a safe space and clear boundaries can help them to share their thoughts and feelings. However, in adolescent mental health nursing, the therapeutic relationship is not only between the nurse and adolescents, but also with their parents and family. Okay, when basic therapeutic relationships have been developed, we can start to discuss emotion regulation with patients. Encouraging them to express feeling is the first step. When patients start trying to talk about personal feelings, it's also important time to convey your empathy to them. And these are some skills that we can keep in mind. Especially over-aggressive or light-hearted manner should be avoided. And always remember to give more time to response. After expressing feelings, cognition strategies can be used to help patients to better recognizing their own emotions. And then we can further to focus on identifying and modifying dysfunctional thinking. And during this process, the important issues related high-risk time, triggers, and more adaptive coping response will be discussed as well. In particularly, discussion about negative thinking in automatic process, examining the accuracy of perception, identify the irrational beliefs are all the process of promoting realistic. At the same time, encourage patients to think personal strength and accomplishments and discuss alternative ways of experience feelings such as writing journal, talking to others, or drawing are needed. Last but not the least, reinforcement is also important to encourage to practice the new learned coping skills. Therefore, emotion regulation is actually a process of increasing self-understanding, self-control, and self-esteem. Another nursing intervention is related to social engagement. Due to the depression symptoms, patients might be quite withdrawn and prefer to stay with themselves only. Therefore, social engagement should be gradually encouraged as well. For example, at the beginning, we can encourage patients to participate in simple activities under nurses' accompany, and gradually encouraging to observe other group activities to finally join the occupational and recreational activities during hospitalization. Apart from this, in order to prepare for the social life after the discharge, we need to discuss in advance about adolescents' needs and expectations to find out what activities they are interested in and can join to. The last nursing intervention is psychoeducation. The aim of psychoeducation is to improve ability of self-care for adolescents. So, health education about depression and medication, self-care toolkits, and community service should be provided. This is one of example of self-care designed for adolescents. Also, psychoeducation should be delivered to adolescents' parents or caregivers. And the first thing to tell parents or caregivers is making home safe, like remove or lock dangerous objects, put medication in the safe place, and develop a suicide emergency plan and safety plan. Telling parents or caregiver about the myth of suicide. Telling parents or caregiver about the myths of suicide. For example, people often feel uncomfortable talking about suicide. However, asking your child whether he or she is depressed or thinking about suicide can be helpful, so that parents can be more aware to the warning signs and triggers related to depression and suicide, such as drinking, playing the game of death, searching for death information. Another important thing is that when young people are in crisis, their parents might feel they are in crisis as well. So, if encouraging parents or caregivers to join support group, it's helpful for relieving their own anxiety and stress. In terms of community service, there are more and more useful self-help resources. For adolescents, they are more familiar with online resources or applications which are particularly related to their lifestyle. For example, suicide prevention application includes information, education, self-diagnosis tools, a direct link to a 24/7 helpline or lifeline, and other local supports. Also, we have to let adolescents know that it's important to remember the emergency call of campus security office. After the discharge, there are three main points that we have to do, which is handover, follow-up, and documentation. Firstly, handover to community nurse can continue the care for adolescents. Secondly, make sure to follow up patients within 7 days after discharge, since sometimes it's quite anxious when going back to the society. So, it's important to evaluate how their moods, how their social school life, relationship with peers and family, or how they take their medications, and any challenge they are struggling, and etc. All of contents of handover and follow-up should be documented. So, when adolescents back to the community, mental health professional is the basic thing to do to enhance their resilience. It can be done by organizing workshops such as the topics of life education, stress coping, sex and relationship issues. Also, CPR training for mental health is important to educate for school teachers and families. And then we can use screening tools to identify if any adolescents are at higher risk of specific issues, so that we can put more attention on them and be alert to their early warning signs. Since depressed adolescents might feel a sense of hopelessness or emptiness when they cannot reach their expectations, and at the same time, if they have energy during the recovery period, it will be a time of risk at conducting suicide. However, if adolescents are at low risk, it does not mean that it's not necessary to receive a service. The service should be individualized and based on different situations. So, we also need to keep reducing risk factors and promoting protective factors in the community setting. And during the process, if we find that some adolescents have high score of assessment tool, potential psychiatric symptoms, suicide thoughts or plans, their issues are beyond our capability to deal with, and they don't have sufficient supports, then we need to make a referral to clinics, suicide prevention center, or hospital based on their condition. And this is a reference of clinical flowchart for plenty patients with suicide thoughts and plans. Thank you for listening. This presentation can help us to go through the nursing care and suicide prevention for adolescents with depression, and we can learn it together. Thank you.